feeling a pinching sensation in the bottom of a squat in your right hip? Could it be the dreaded hip impingement? Hey, this is Gary, your not so average trainer who has studied a little bit more than the average trainer. Okay, that's just a little bit of advertisement for myself. But anyway, this right hip pinching issue is something that I personally have experienced. Okay, like everyone else, when I got this issue, I went online to search for the solution and maybe try to find a diagnosis what was happening. At first, I thought that it was this right adductor strain because I was feeling this almost at the attachment area of the inner thigh, or maybe not, but I was led down many rabbit holes by Dr. Google. That's what happens when you consult Dr. Google. So at one moment I thought I was having a right adductor strain. The next moment I was actually thinking I have hip impingement issues that that required surgery. So there wasn't really any conclusive solutions. Okay, so it's not until I met or came in contact with Postural Restoration Institute, and that's when it really helped me with my issue. Okay, so let me try to explain to you biomechanically what is happening when you're experiencing a right hip pinch. So us humans all have this asymmetry in our body, right? So we have our left pelvis, this left side, slightly more forward and lower than the right side. Now when this happens, right, we have right side closing in a bit more, left side more flat out just a little bit. And when this happens, the right side of our hip, this femur, the thigh bone, actually turns into internal rotation a little bit more. Okay, so in my particular condition, I was an avid soccer player. I was very one-sided. So when you have this very one-sided kind of activities over and over again, then you tend to have more funky stuff happening in your pelvis, which is what happened to me. So my left pelvis basically was pushed so far forward, further forward than what a normal asymmetry would be. So then you can imagine this internal rotation comes in even deeper. Okay, so now when I go into a squat, okay, I'm trying very hard to get this model to work like what I want to. So when I have this left pelvis forward, push forward, my thigh bone comes in internally rotated. Now, is this extreme example, okay? Now when I go down into a squat, when I'm squatting, right, can you see this part pinching onto the innominate? Okay, the innominate, which is this big bone, flat out bone, pinching on each other. So I experience pinching even as I'm walking. Probably it was quite inflamed at that moment. So if that's you, this is probably what is happening. Okay, so now let me help you with two very simple solutions. And do this before you even consider surgery, okay? Solution number one, we're gonna try to pull that left hip that's so far forward back. And the activity I have chosen is this high to low side cable chops. So push the cable setting to its highest point and then chop the cable down or pull the cable down towards the left side. Okay, making sure to initiate the movement by pushing your left butt back. It shouldn't go out to the side on either side. It should be going back posteriorly. Okay, now when you do this right, you are going to feel a stretch in the left hip area, okay, posterior hip, the back part of your hip, and also a lot of inner thigh on that left side. You got to line up your hip, your knee and your ankle joint as you chop it down. So shifting your weight on to your left, especially the heel area, pulling the cable down towards the outside of your knee. And that's our step one. Let's go to step two. After pulling our left hip back, we need to make sure that right hip, okay, can actually help push into our left side. So what's going to help us do that is this glute max on that right side. It has to open this pelvis a little bit, okay, bring it into external rotation and making sure we go back into our left hip, okay, or closing off that left hip. So now, the activity I've selected is this right step out lunging action. Okay, hold a dumbbell in your right hand and then step out into this side lunge. Okay, bringing the dumbbell towards the outside of your shin or your ankle, making sure again to line up your right hip, right knee and your right ankle. Okay, so you're going to shift your weight entirely onto that right side as you step out into that lunge, and then forcefully push in the ground with your arch area. So the arch of your foot should be like you're trying to flatten that arch, push yourself back into standing. That's one key point there, okay? Please take note of that. Okay, so you're going to do these two exercises back to back. First with the chop, and then after that with this side lunge to the right. Perform about like 3 sets of maybe 15 repetitions each. Go light first and then progressively load your way up. Once you have done 3 sets, go retest your squat. It should help you reduce that pinching sensation significantly. Alright, so go through a few sessions of that before you start going back into barbell squatting. Okay, so we've come to the end of the video. Now I hope you found this video helpful like always, because this is something I personally have experienced before and these solutions actually help me. So I hope that this can help you too. If you have any other questions or problems, please leave me a comment and I'll try to answer them. Okay, please help to like and share or subscribe to this channel. It will help the channel grow and I'll push out more content like this. Thank you for your time and I'll see you the next time.